Thank you, sir. Good morning and good afternoon, everyone. Hello. First of all, I thank to this conference team for giving this opportunity. Thanks to my college management and principal, sir. And I glad to introduce my co-presenters, S. Priyanka and S. Selvalakshmi, CRRI, Sri Sairam Siddha Medical College, Chennai. My topic is a review on immunomodulatory effect of Siddha formulations. According to the first, sir, next one. According to our Siddha system, according to this poem, medicine is referred. Excuse me.
No, there was one microphone went on. I just muted it. Just go on, please.
Okay, no problem, sir. Marupadu udal noi, that means a medicine prevents the disease, heal or treat the diseases, both physical and mental illness. Introduction to Gorosanai Matra. Herewith I expose the some Siddha formulary preparations: Gorosanai Matrai, Urai Matrai, then Purna Chandrodayam, and some Siddha formulations. So it's derived from herbal drug, also herbo mineral drug. First, I introduce Gorosanai Matrai. Gorosanai Matrai, most of the paper mostly based on already published articles, literature, Siddha literatures, and from my clinical practice. A review of Gorosanai Matrai. Gorosanai Matrai mostly used in pediatric ailments. It's for mostly in Indian system of medicine, we use the Gorosanai. Gorosanai, nothing but cow's bile. It's prepared from cow's bile. That only. The Gorosanai Matrai. Next one. Gorosanai Matrai having the ingredients of Quercus infectoria, Piper longum, then Gorosanai, Sasuria lapa or Sasuria costus, then Nigella sativa, then Anacyclus pyrethrum. Already Gorosanai Matrai published by some doctors from the Sri Lankans. It's published in Jaffna University, Jaffna conference, one international conference. I reviewed it. They published the trialed the paper, clinical trial. 50 children they used. 42 male patients, 56% females, from two different places for cold and prevent the cold, because that people having repeatedly affected by common cold. So the doctor given the clinical trial for the two places to prevent the common cold. So the result is preventive measure, both of the places 11% and 14%, then relieved from the cold 83% and 75%. Next one is the Gorosanai Matrai, commonly used in pediatric ailments. Next one is Sindal Chakra. Sindal Chakra, nothing but it's derived from the Tinospora cardifolia. Tinospora cardifolia, it's called Gudusi Sattva in Sanskrit. Chatva means extract. So that the extract from Tinospora cardifolia. Already the research articles, immunomodulatory effects of Tinospora cardifolia already on macrophage activation published. So I include that immunomodulatory effect of isolated fractions from Tinospora crispa, INFY, IL-6 and IL-8. Then the result is the immunomodulatory effect of Tinospora cardifolia already they proved and published. So the Siddha medicine Sindhal Chakrai, it's called Sindhal Chakrai, Sanskrit Gurusi Chatva. It's a very good immunomodulatory effect. It prevents the disease. We know the immune system, what is immunity? It limits the growth of organism or limit the growth of entry. Also called immunity. So these medicines working give good results. Entry also, limit the entry also, limit the growth of microorganism also. So that for a carifolia extract, that means formulation name is Sindhal Chakrai. It's having good effect of immunity. Next one is Urai Mathirai. Urai Mathirai also used in Indians, especially in North Indians, Karnataka, Kerala, then Tamil Nadu, used more, even though practitioners, registered practitioners also used it, having the next one, sir. Urai Mathirai. Next one, sir. Next one, sir. Next one, sir. It contains Corcus infectoria. Next one, Piper langum. Thank you, sir. Glycyrrhiza glabra, Mystica fragrans, Gingiber officinalis, Anacyclus pyrethrum, Acorus calamus, Terminalia chebula, Allium sativum, then Ferula asafoetida. Next one, sir. Already the individual properties from the botany department, they published the paper having the actions. That means anti-inflammatory, then it having the contents of tannin, because already I told the Gorosanai Matra also having Corcus infectoria, Piper langum, and Anacyclus pyrethrum. In same, this preparation also having Corcus infectoria, Piper langum, and Anacyclus pyrethrum. Most of these content like Gorosanai, Anacyclus pyrethrum, Corcus infectoria, and Piper langum, it acts on over, especially Gorosanai, it acts on over respiratory muscles, then CNS system, then cardiac system. That's why we give the Gorosanai Matra or Urai Matra in pediatric ailments. Not only ailments, in prophylactic action from the birth, we use the drug for prevent the disease, also prophylactic. Next one. Review on research articles over the Urai Mathirai. Already it published by Dr. Satya Rajeshwaran from CCRS. The Urai Mathirai anti-inflammatory and analgesic effect. So I input this input this paper also. The Urai Mathirai having anti-inflammatory and analgesic effect of Urai Mathirai. Next one, sir. Next one, sir. The trial method is here. Next one, sir. Thank you, sir. Next one. Purna Chandrodayam. Yes, sir. Thank you. Purna Chandrodayam. This is herbo mineral drug composed 12 raw materials and medicines used it. It's mainly used for bronchitis, cough, allergic rhinitis, etc. Also, it giving also it include Kayakalpa drug. We know what is Kayakalpa. Kayakalpa also treat the diseases, physical diseases, treat the mental diseases, treat the prevent the diseases. So the Purna Chandrodayam also under Kayakalpa drug. This used by 2 tablets with betel leaf juice. This is given by time after food. It having adjuvant betel leaf juice. Betel leaf juice also having enzymatic activity known well. Enzymes activities, digestive enzymes are this betel leaf juice act like as enzymes, digestive enzymes. That's why we give the betel leaf juice or betel leaf for pediatrics. So the Purna Chandrodayam having the ingredients of Cinnamomum camphora, Elysium verum, Cinnamomum tamala, Mystica fragrans, Syzygium aromaticum, Cinnamomum vitae, then Piper nigrum, Piper langum, Gingiber officinalis, Saccharum officinarum. Review on research article over the Purna Chandrodayam. The Purna Chandrodayam also, the toxicity studies also done. Herewith I conclude the medicines, Urai Mathirai, Purna Chandrodaya, Gorosanai Matra, we are using in daily practice. Also, Purna Chandrodayam and Gorosanai having high content of calcium. The calcium may reduce the in COVID time, we used the calcium or vitamin D3 more quantity because it reduces the inflammation, also prevent the infection. It reduces the infection also. It reduces the respiratory difficulties. So the Purna Chandrodayam Gorosanai Matra acts on respiratory muscles also. So it reduces the breathlessness, then side effects also. Herewith I conclude the Purna Chandrodayam, Urai Mathirai, then Gorosanai Matra having good effect to prevent the disease, also reduce the symptoms. That's why I include this immunomodulatory actions. In Siddha formulary preparations, Gorosanai Matra, Urai Matra, not only this, having more Siddha formulary preparations having immunomodulatory effect. Just I review 4 medicines only. Thank you, sir.